Good afternoon, everyone. It is now noon, so we'd like to go ahead and get started. I am Helen Hockey, the Executive Director of the Pennsylvania Coalition for Oral Health, and we are so happy that you have decided to join us today. This is our 5th year of offering virtual meetings. We know it's sometimes difficult, even in normal times, to make a trip to attend an all-day meeting in person. And particularly at this time during the pandemic, it's been a little more difficult than usual. So we're happy to offer these brief updates semi-annually. And as always, these meetings are recorded and we share them on our YouTube channel. So if you missed something or you have to cut out and you want to come back and view it later or share it with anyone, you'll be able to do that after today. So just some housekeeping as we get started. All lines have been muted by us, which will keep the background noise to a minimum. If you're joining us by computer, you may type any questions into the Q&A box, which should be in a bar at the bottom of your screen at any time during the presentation. So we may be able to grab them as they come in, but if not, we're going to answer them during the question and answer time at the end. So for those who are joined by computer, you're also going to have the opportunity to participate in some polls that we'll put up periodically throughout the presentation. For those who can't join by computer at this time and are joined by phone only, we would just encourage you to go back and review the video at a later time so that you're able to fully see the slides and the results of the polls. So we will send the link for the presentation out directly to everyone who participates today, as well as the slides by themselves so that you can click on any active links. So with that, we would like to go ahead and get started. Our board chairperson, Dr. Deborah Polk, is going to say a few words of welcome to everyone. Dr. Polk?
Hello, and thank you so much for joining us today. I am delighted that everybody is here to hear about our work. And really, that hour is an inclusive hour because we are a coalition, which means that we are working with you on all of the projects that you're going to be hearing about. So I hope that you hear about some things that maybe you are involved in and have the opportunity to learn about projects that we're working on with other organizations and get the full picture, the big context. So with that, I hope that you find your time well spent. And please, if there's anything that you excites you, that something that you want to get involved in, please join us on all of these projects. Thank you.
Okay, thank you, Dr. Polk. So as we get started, I just want to do our first quick poll to get an idea of who's with us today. If you've joined us in the past, you'll recognize this question. We just always like to know how many of you have joined us in the past and how many of you are new to the coalition or maybe haven't joined us in a meeting before. So you should see a box come up on your screen and you can click one of those answers. We'll give everybody a minute to fill it out. We're still a fairly young organization, so we're growing our stakeholder list all the time. So it's really nice for us to know who might be new to us and who also has been around for a while and is more familiar with our work. So we'll give everyone about 10 more seconds on the poll. I did want to give a special thank you to Amy Tice, who's our staff member on the back end, working her magic on all of these polls. So we'll go ahead and take that down and check out the results. Okay, so 87% have attended a PCOH meeting or event before, but 13% have not. So that's pretty great. I'm glad that everybody is here, and I hope that you'll find this webinar super informative and helpful to your work. So I want to take a minute just to talk a little bit about what PCOH is and what we do, particularly for the 13% who maybe are joining for the first time. Many states have developed oral health coalitions over the last 20 years, and their main purpose is really to gather groups and individuals who are passionate about oral health and help them communicate and work together. So Pennsylvania is part of the American Network of Oral Health Coalitions, which is a national network of similar groups. And we range anywhere from 35 to 45 state oral health coalitions being formalized at each time. So The coalition, our coalition was formalized in 2013 with the addition of staff as well as a more formal board structure. We are a registered nonprofit and we rely on grants and donations to complete the bulk of our work. So in just 7 years, we've grown to nearly 900 stakeholders across PA and 3 full-time staff. Every stakeholder we add, helps to contribute to our reach and our knowledge base. And for that, we're extremely grateful. Those connections that we're able to make around the state mean that no one has to recreate the wheel and we can all learn from each other and our work. As I mentioned, we're fortunate to have a lot of support from many corporate and community funders. PCOH is a registered 501c3 nonprofit, and we are happy to report that anywhere from 80 to 85% of our funds annually raised go directly to programs, both that we provide directly and then through our partners and subcontractors. So we work with a lot of different grants, but we also rely heavily on our corporate and organizational and individual funders to keep us moving, even on a lot of smaller projects and resources. So many of our funders have been providing annual support for many years, even since 2013, and we really couldn't do it without them. So we would encourage everybody to visit our website, and you can click directly on our funders' logos to learn more about them if you're interested. Also just want to make sure that we're taking the time to thank everyone who's contributed, even on an individual basis, to our work. So if you're interested in learning more about, a sponsorship or making any personal donations, we are happy to discuss that with you at your convenience, and you'll see the link there to reach out to us. So if you're new to the coalition and you visit our website, you can also see some of the projects and work that we've accomplished in the past by checking out our annual reports. They're housed on our website on the Who We Are page, and they date back to 2017. So the link to that page will be included on the slide, so you can go and check that out. But we try to capture everything that we do in a year in one nice streamlined report. So it's a tough job, but I think we've done it fairly well for the last few years. So the next slide you'll see here is speaking about the 4 main priorities of our work. So these are the main focus areas that were developed back in 2015-16, where, our board of directors really wanted to work on a few kind of key areas. So we talk a lot about oral health workforce. We talk a little bit about, a lot about advocating for community water fluoridation. And we want to also work on things that improve oral health for the most vulnerable populations in Pennsylvania. And some of that work is then done by our 4th priority, which is working to include oral health and policies in all different kinds of systems. So those are our main priorities. And we're going to put up a second quick poll here just to see which priorities you would consider an integral part of your work. So you can, out of those 4, when we're talking workforce, fluoridation, oral health access for vulnerable populations, and then policy, you can select more than one, but, if you can take a second just to choose what you sort of view as the things that affect you most in your work. As we move forward with our discussion of the 2020 work we've completed so far and the goals we have for the rest of the year, I did want to point out that some of these items will include work that's done independently by PCOH, but most of our work is collaborative. So, we really work to improve overall oral health in Pennsylvania, but some of the stuff we're going to report on is things that we just know are happening by other groups and organizations. So, but we want everyone to have the most recent updates of all the different projects that are going on. So if, you can offer even your help too, if you're sharing resources with us or checking in with a staff member to let us know what you're working on, or even actively joining one of our task forces or work groups. We really appreciate all of the time and effort that you all put into advocating for improved oral health. So with that, we'll give about 3 more seconds on the poll here, and then we can pull that one down and see what the results are. Let's see what everybody's marking. Our access and vulnerable populations priority has definitely won the prize with 75%. So that's great to see. And it looks like 63% said that policy is a key area. workforce at 25%, and 13% with fluoridation. So that's wonderful. Thank you guys so much for contributing there. And we'll talk a little bit about ways, we're going to talk about all of those areas, but ways that you can, get more involved as we move forward. So the first thing, we're going to talk a little bit about the work we've been doing right now, as well as what we've been working on the last 6 months. When we talk about oral health workforce, we're including dentists, hygienists, assistants, dental staff, community health workers, insurance and health plan staff, community navigators, medical personnel, so many different groups that we would consider to be part of the oral health workforce. And, our coalition is somewhat concerned right now. We already have a shortage of workers in some areas of the state. And sort of as a result of just sort of natural attrition and the COVID pandemic, we're really expecting to see a higher number of shortages in the next few years. So when you see this map on the top here, this is a map directly from the Health Resources and Services Administration page. You may know them as HRSA. And they basically do surveys on a regular basis to find out where we're not meeting a basic ratio of 1 provider per 5,000 people. So this map is from September of 2019. It's the most recent one that they've put out. And those shaded areas and dots all designate dental health professional shortage areas. When they've kind of done the numbers and crunched the numbers, they've determined that in order to meet all of those shortage areas, we would need to add nearly 300 dentists in our state in those specific areas. And that doesn't take into account that in order to meet all the needs in the areas, the providers would need to participate with all insurances, they would need to treat patients under 3 years old, treat those with disabilities, et cetera. So just sheer numbers, we need 300, but that's not anything indicative of the quantitative or qualitative amount of what they're doing as a provider. So of course, knowing that we were already there, we're very concerned that the shortage could be greatly exaggerated by the pandemic and the long-term economic effects to the dental industry. We will say, the second graphic there is basically a designation that HRSA does as well that explains that nearly 2 million Pennsylvanians reside in those areas that are considered dental health professional shortage areas. So that's pretty significant, I think. And we see a pretty big swath across the northern tier of our state when we're talking about provider shortage areas. There are options like loan repayment that are meant to entice dental providers to practice in those areas. But funds are limited for those programs. We know now that, more people are applying than there are funds for. And the amount of repayment isn't always enough to justify, a dentist choosing to move his or her family to a rural area that may not offer all the amenities that they need. So, through discussions with a lot of our stakeholders and a lot of digging around, what we really know is that the key answer to getting dental providers to practice in these areas is to really motivate and encourage individuals who are from those regions to become dental providers. So that's with the assumption that, many of them will want to go back home to live and practice. It's a place they're comfortable with. So some of our work really has focused on how do we improve those numbers and how do we get people from rural areas and from shortage areas to talk about and think about dental careers. So with that, we have launched a couple different projects, and those who've joined us before have heard about some of these. We have some funding through our state HRSA grant where we are working on sharing a book called Teeth that was written by Mary Otto a few years ago, and it really goes into public health and all of the information, sort of the dental health crisis in America. So with permission, we adapted a program through the ADHA, the American Dental Hygienists Association, and we were able to bring copies of that book to many different students and faculty over the last 2 years and have book study sessions with them so that we can really talk about the need for public health dentistry and sort of basically just to open their eyes to some of the possibilities that are out there and the needs of the community. So we're happy to report that at this point we have now trained more than 500 faculty and students at the dental programs and dental hygiene schools in our state. And we're collecting data, and we'll be putting out a formal evaluation report on that work so far sometime in the fall. Then, we really want to know, how likely are they to work in public health? How likely are they to work in a rural area? Those are sort of interesting questions that sort of help us shape where we're going to go. For changes this year, as many of you know, the universities and colleges have sort of been in an upheaval around bringing students back on campus or not. So we are moving to a virtual model, most likely for the fall. So we'll still be able to reach out to the dental students and dental hygiene students, but we may have to do it via Zoom platform instead. The other thing that we like to do is keep an eye on the admissions. There's not a lot that we can dictate to the dental schools in the state, but we would love to see more in-state students accepted as part of the admissions process, with the knowledge that we may be able to then put more dentists into our communities in state. So that is something that we keep an eye on. The second project, when we start thinking about that, is that, we really need to reach these students before they've already chosen a college or decided what profession to go into. So we've targeted high school students. There's a group called the Health Occupation Students of America, and there's a Pennsylvania chapter of that, PennHOSA, that we work with. Again, attending their conference meetings, talking with their advisors. Of course, the conference was canceled this year, so we're going to be sending out a lot of materials on, basically what dental careers are, how where you go for a dental career, where those dental health professional shortage areas are, but giving them sort of the information so that they can make a decision to maybe choose a career in dentistry, knowing that it is a high demand career. So we also are going to, this summer, because we weren't able to do some in-person work with the high school students, we wanted to sort of add some additional reach. So we're going to be reaching out to all of the guidance counselors at the high schools in the dental health professional shortage areas, and distributing information, not only sharing that teeth book with them, but also the same materials we've given to the PennHOSA students, so that hopefully we can get some guidance counselors starting to talk. If a student comes into their office and says, I really think I might want to be a nurse, or I want to work in health, well, let's start talking dentistry then as well. Let's not forget that that's a great health career option for many students. And that information that we're distributing to the guidance counselors and to the PennHOSA group is available. If you need, copies of things because you're working with a youth or adolescent group in your community, a youth Rotary group or a Scout group, we're happy to share those materials to try to get more people interested in those dental careers. And we, of course, are trying to encourage that all the providers that are already practicing to be more inclusive. So one of the things that we do is we have a free webinar portal on our website. Some of the courses are available to grant CE, continuing education credits, some are not. But we want to be able to give some training modules on things like tobacco cessation counseling, community water fluoridation, treating patients with disabilities, et cetera. So that if we can get our existing practicing providers to start thinking in a more public health frame, we hope that will also improve the workforce in our state. So lastly, under workforce, I did mention tobacco cessation counseling as something that we have training on. This was a new project for us this year, so I'm super excited to share the information. We had a really great partnership prior to this year with the Northwest Tobacco Program up towards Erie, and they have really wanted to extend some of their outreach to dental providers. So many of you might know that the Medicaid fee schedule added a fee for tobacco cessation counseling for dental providers back last August, so August of 2019. And so a lot of dental providers are able to bill for that now, but maybe they're not as comfortable talking about tobacco or nicotine cessation with their patients. So we developed this course in partnership with Northwest Tobacco Program, and first offered it as a live webinar, I believe on June 2nd. We had 35 providers in attendance on that call, which was great. And then since then, we've put it up as a recorded webinar, and we've had an additional 47 dental providers take the course. So that's, in just over a month's time, we've had 80 attendees for that course, which I think is great. And part of that program we're doing is also offering some chairside materials, on the pharmacotherapeutics and pharmacotherapies that you can take for cessation, as well as information on the quit line and quit logic. So those materials are available for anyone who requests them, which has been, we've actually had quite a few people reach out for those. So our goal and our ideal, situation here is that we have a workforce that's strengthened and feels it's part of their responsibility when talking about oral health to also include nicotine cessation. That's a win-win for everyone involved. We also were connected with the group National Jewish Health out of Colorado, who runs the quit line in about 18 states across the country. And they have asked us to develop some programming for their coaches around the effects of nicotine and tobacco on oral health, and basically to help their quit line coaches talk to the people who call into the quit line about how the benefits of quitting will actually improve their oral health as well. So that's a project we're going to be rolling out. We're doing the training in September for those quit line coaches. We were recently connected with a project out of Maryland. Many dentists are already doing hypertension screenings in the office, but we know that there's room for improvement on that. So we're working with some partners in Maryland and hopefully developing some outreach with the American Heart Association to do some education around the importance of screening for hypertension in the dental office. So that's something that's brand new, just came up in the last few weeks, but I wanted to share it with everybody. I know we've had some small pilot projects across the state, mostly I believe with federally qualified health centers around that. So it would be great to push that out more wide scale. So, and lastly, I would be remiss to not talk a little bit about COVID-19 communications when we're talking about workforce, as there were a lot of miscommunication issues, or maybe just confusion around a lot of different parts of how dentistry was affected and the dental industry was affected by the PA Department of Health, and all of the mandates and information that came out in the spring. So things were changing. I really want to thank everybody for sort of being flexible. It was definitely a pivot time for quite a few weeks with the different guidelines coming out. And we were able to sort of try to help the Department of Health with manage some of those communications. So, the materials that came out were definitely, I think, up for interpretation in a lot of ways as to how dentists should be maintaining their practices. We tried to assist with that as best we could. So, namely the reason I talk about that is just that it was something that took up a large portion of our time throughout March, April, and May. But we were able to borrow some materials from one of our other state oral health coalitions and put together a really nice patient information document that the Department of Health was able to co-brand and put on their website as well. So hopefully throughout this, we've been able to provide some clarity to both providers and to individuals seeking dental care. And I know it's not over yet, so we've still got probably quite a few more months of weeding through all of this. So I thank everybody, all of our stakeholders, for all of the assistance that you gave in helping us with this stuff. So shifting gears to community water fluoridation. Our work in community water fluoridation is really centered around a few areas. We work under the CDC grant that the state has to sort of help partner with water systems. Community water fluoridation is something that we know is a public health measure that we need in our state, and we need to increase in our state. Our most recent data says that we're somewhere in the neck of the woods, 50 to 55% fluoridated of those who receive fluoridated water from a water system in the state. And the Healthy People 2020 goal, was up to 79%. So we are falling fairly short on that. So how we are working to sort of fix that problem is through a couple different ways. Working with the water systems, finding out how is their equipment? Is it getting older? Does it need replaced? How can we help you with that? Do you have questions? Do you need a new supplier? Try to, really sort of head off any major issues before they become media sensations. And so we were able to partner with 7 different water systems in June and issue $153,000 in equipment grants through the CDC grant, which was just a really amazing process. And we've gotten a lot of great feedback from that. Those systems are actually committed now to continuing to adjust the fluoride in the water for the next 5 years. And then we'll be rolling through in the fall with finishing our equipment survey of all the systems that fluoridate in the state so that we can see where the needs will be in years to come. Part of watching community water fluoridation is, of course, monitoring rollbacks. A rollback would be defined as, a water system that does adjust fluoride in the system and then decides to no longer do that. So essentially to no longer fluoridate the water. So we like to we have a team basically all across the state that, we've got a task force that works on water fluoridation and responds to any questions or comments. If we need someone to speak at a public meeting, we have a group that does that. And then we also have a program that we call SWAT, the Statewide Water Action Team, with some materials like magnets and things that you can distribute in your community so that if there is a threatened rollback, that we would hear about it first and be able to hopefully head off any concerns. So if that's something that, you work with some community groups or you want some magnets and some information, please let us know. We're happy to share that with everyone. Just as a sort of data point, we've had 5 rollbacks or threatened rollbacks in the last 15 months in Pennsylvania. So that's out of approximately 200 systems that fluoridate. We've had 5 in the last 15 months that have threatened to cease fluoridation. And so, we've had some various results between these ones that are listed. At this point, we still have 4 of the 5 sort of pending. We were able to, in some of the communities, at least delay the decision because, of course, in a community, you don't, in a time when it was difficult or still is difficult to get to your dental office or your family physician, you don't want to take away a public health measure like community water fluoridation without allowing the community to prepare. So we've been able to sort of use the pandemic situation to encourage these communities to at least delay their decisions if they've decided to discontinue fluoridation. So along with that, I mentioned there's 200 systems that fluoridate. We continue to track which systems do and don't. It's not something that's clearly tracked or hasn't been clearly tracked in Pennsylvania. So the Department of Health has been great working with the DEP, and we're building a pretty good system now of being able to track more accurately those systems. And part of that then includes educating the general public and health professionals about community water fluoridation. So our state will be putting out a fluoridation plan in the coming months. And we're also celebrating this year the 75th anniversary of community water fluoridation, which is a pretty big deal. So a lot of the events around that have been canceled due to COVID, but we're still wanting to make a big deal of it. We're going to be working with the Department of Health, who will be putting out some ads and commercials and materials and things in the fall. So some really good stuff coming out there. And then lastly, for community water fluoridation, I just wanted to touch on this map. We've just completed this mapping project, but an amazing student from Mercyhurst who worked on some GIS maps for us. And our goal, hopefully, as you can see this map, the green are non-fluoridated areas and the blue are fluoridated areas. Our goal is that we will build some layers and build a functionality into our website where we would be able to put this map on our website and you could actually toggle through it based on the specifications you needed. So if you wanted to see fluoridated areas by school district or by legislative district, you would have that option to toggle on those layers and to be able to zoom in and see your area. So it's not an exact science, but we're pretty pleased with this map and we'll be sharing them as part of our work in the coming months. So our third priority is working mostly on improving oral health for the most vulnerable populations in our state. So of course, just wanted to talk a little bit about some of the work we're doing. We are assisting the Department of Health with their school sealant programs. So school sealant programs are typically offered as clinical programs where providers go directly into the schools and apply dental sealants. They can be in conjunction with other preventive services, but we really need to get a little bit better at tracking those. So within CDC, they have a program called SEALS, and they would like all of the states to begin tracking their school sealant program data through that SEALS program. And we're going to be bringing everyone online into that program and hopefully adding new school sealant programs in the years to come. Also, under our HRSA grant, we were able to add dental services to 3 rural health clinics across the state, working with the Pennsylvania Office of Rural Health just since 2019, which has been great. Teledentistry, of course, has become very popular, but we've been assisting with a pilot up in Northwest Pennsylvania, working with the Erie County Department of Health and the State Head Start Association on increasing teledentistry services to the local Head Starts up there. So that's been a really great project, and we've seen some good outcomes from that. The obviously, working with underserved populations includes working with our state managed care organizations who help provide services and the health plans under state Medicaid. We have a fairly robust child benefit in Pennsylvania under our state Medicaid system, and we are looking to improve our adult dental benefits as well. So we'd like to see a few more services added to hopefully decrease the overall disease rate. So that's been a big deal, and a lot of our work is trying to see what we can do. You know, the managed care organizations have really stepped up, I would say, in the last few months. Many of them are now covering services like silver diamine fluoride for adults, which, you know, is a medicament that helps to arrest dental decay. And so, you know, they've added additional services. They're, you know, really promoting the use of teledentistry and all the preventive things that you can do with that, like tobacco cessation counseling or nutritional counseling. So it's been great to see those services offered to more and more individuals under the state's Medicaid plan. And then, of course, part of our work involves a lot of media outreach. So, you know, we've done a handful of interviews over the last few months, some around COVID, some around access, you know, some around both, and try to reach as many people as possible and get people really thinking about oral health. So we've done a couple surveys in the last few months. I would say these ones actually cover probably the last year. Many of you have probably seen the ADA's Health Policy Institute has been doing bi-monthly surveys of all the dentists across the state, and they have a cohort that have been answering questions since COVID began. And what we realized was, you know, Pennsylvania really needed to take a hard look at where we were going to be. So we have a survey that we launched a few weeks ago. It's still open, so that link's going to go around if you haven't had a chance to fill it out, or if you work with any dentists and you're able to share it, that would be great. But so far what we have found, and you can see the numbers there, that we're seeing, you know, a handful of dentists that have closed or will be closing permanently or have chosen to retire and leave the field. You know, nearly, you know, or about a third have added a PPE, personal protective equipment fee to all their visits to cover the increased cost. And then we've seen a handful not only dropping out of state insurance, namely Medicaid, but also 7% have now said that they've dropped out of participation in private or commercial insurances. So I think we're going to see that roll into a bigger access problem 6 months from now, and we're going to be keeping that in mind as we move forward with our planning. We also did an access survey late last year, I believe, or early this year, geared towards just the general public to find out who was having issues with accessing a dental home and, what could maybe be the issues there. What was interesting is we had, I believe, about half of these respondents have commercial insurance, but yet nearly half still reported having trouble finding a dental provider. And of, 50% reported that the insurance participation was the hardest barrier to overcome. So I think that really is telling on where our access issues are. It very much seems to center around insurance. And so that's a place where we need to really look hard. And then we did a survey in partnership with a lot of different organizations last fall, where we reached out to the general public to find out about emergency room use for dental problems and opioids. And what we found was that of the nearly 300 responses, that 1 in 6 have visited the emergency room for dental pain, which I thought was pretty extraordinary. And then of all the responses total, 30% of them have been prescribed an opioid for dental pain. So we want to keep an eye on that. We want to make sure that, we're not letting untreated dental disease contribute to the opioid problems in our country and in our state. A little bit around the policy support work that's going on. We were able to have HR 799 introduced with our partners at Achieva in March. That was a resolution asking for an official Legislative Budget and Finance Committee report on the adult dental Medicaid benefits, just so we can identify where our issues are there and how we could improve. We do advocate on a federal level for dental benefits to be added to Medicare. I'm sure most of you are aware that there aren't any standard dental benefits under regular Medicare. So our older adults over 65 really struggle trying to pay for dental care. And then there's a bill that was introduced in our state to basically extend the enrollment for pregnant women under Medicaid. So currently we have a situation where pregnancy-related Medicaid eligibility ends 60 days postpartum. So many women are then, left without coverage. They're at a greater risk of, getting those critical health services they need right at the time where their child's just 2 months old. So we definitely support extending Medicaid coverage so that we can, see these, maternal and infant mortality numbers go down. States that have already extended the Medicaid coverage for postpartum women have actually seen a 50% reduction in infant mortality over states that have not. So I think, we know that that's a really important thing. And from a dental perspective, you've got a much better chance of getting that child into dental care at age 1 if mom's able to continue that care up until that child is 1. So that's something that we very much feel strongly that we should support. Obviously the teledentistry bill that just came out, I think for those who've gotten our newsletter, you probably saw this, was actually introduced about 2 weeks ago. That would basically help dictate and authorize the State Board of Dentistry to regulate teledentistry and provide for insurance coverage. So I think we're going to start to see a lot of telehealth bills moving forward because we've seen some good success with that system since COVID. We monitor, of course, the State Board of Dentistry regulations. As you know, right now they are working on improving some practice settings for the public health dental hygiene practitioner. So, of course, we want to see more patients get connected to care and then hopefully get the proper referrals to get to a dental home. And then school health. In terms of policy, probably one of the number one things that we hear about from our stakeholders is, the dental screenings in the schools. What are we doing? Can't we provide dental services in schools? So, we continue to work with those groups, both with the Department of Health and Department of Education, and the providers that are working directly in the schools to see what we can do to improve the dental services and the data collection there. just wanted to mention that PCOH serves on all of these committees just as groups across the state. I think that it's really important for us to talk a little bit about sort of how we integrate oral health into a lot of different areas. So, you know, the different groups that are listed here sort of crosswalk between physical health, behavioral health, oral health. And what we would like to do is to make sure that oral health has a voice in all of these decisions that are being made. So, you know, if somebody's talking about HPV, then we've got to make sure that we've got some dental providers at the table. We're talking about, you know, how dental providers can talk to their patients about, you know, getting the HPV vaccine and the relationship to oral cancer or oral and pharyngeal cancer. So, you know, it's really good, we think, for PCOH to have a voice on all of these different groups and organizations and boards. Many of you are probably aware that Pennsylvania is taking over the state, basically as a state-based exchange for the insurances that can be purchased through the marketplace. So right now, our state is managing the federal marketplace for Pennsylvania. We're converting over to a fully state-run, state-managed insurance marketplace in 2021. So we're working on the outreach and education work group of the Health Insurance Exchange Authority to hopefully make sure that the dental needs are thought about as those things get developed. And then I also just wanted to touch on the State Health Assessment and the State Health Improvement Plan, which are two groups that work under the Bureau of Health Planning in the Department of Health, so that they are sort of keeping an eye on a lot of different objectives and making sure that our state is getting healthier as a whole. So we have a lot of oral health stakeholders on those teams. So thank you to everyone who does participate in those as well. I mentioned that our state oral health plan, I know that's been a hot topic lately. We were working under a 2017 to 2020 state oral health plan under the Department of Health Oral Health Program. And so that just wrapped up effective June 30th, and we're now sort of compiling all the information of, you know, how effective was the first 3 years there, you know, what changes did we see? We're going to be looking at surveillance indicators to make sure that we're seeing, you know, good shifts in the data. And then at the same time, working with the state oral health program to launch a 2020 to 2030 state oral health plan. So for those who attended any of our stakeholder meetings last year or answered any of our surveys, you know, we were able to sort of compile the voices of everybody and come up with a pretty nice 10-year plan, which we shared with all of our stakeholders a few weeks back and got some great feedback from everyone. So stay tuned. By the end of the year, we should have a fully published state oral health plan to sort of help guide us moving forward. Under our CDC grant, I mentioned that we could look at the data of childhood caries. So the basic screening survey is something that is recommended by the CDC and the Association of State and Territorial Dental Directors to get basic surveillance on dental decay in basically a lot of age groups, but for young children, we look at third grade in particular. And our original plan pre-COVID was that we would actually be launching our basic screening survey in just a few months, which would be the first of its kind to be done in Pennsylvania. Because of COVID, we weren't able to train and calibrate our screeners, and we've had to push back that program for a year. So our plan now is that we would train our screeners in the next year, and then in the fall of 21, we should be able to hopefully launch our basic screening survey and collect some data for Pennsylvania. We obviously continue to advocate for increased state appropriations to our state oral health program. We would love to see, you know, we use Maryland as a comparison quite often, but their state oral health program has 16 full-time staff. So, you know, our goal is that we would love to see, you know, our program gain as much momentum and be able to help even more people improve their oral health in the state. So we do that sometimes too by looking at where are the holes in our dental access. So we've got a couple different projects that we're working on to address access. We did a charitable work tracking survey back in about a year ago now, And the main purpose of that was to collect data for 2018 on how many services in the state were done free of charge or at a free clinic. And what's been pretty neat with that is that the numbers we found, and we have them on past surveys and slides, but it was millions of dollars that are donated each year through different free clinics and dental providers just sort of volunteering their time and their services. And so we know that there's a bit of an access issue if we have so many people relying on these free clinic events. We do want to repeat the survey and collect 2019 data so that we can do some comparisons. And that's going to be available in August. So if you're a group that works with a free clinic or you're involved in some kind of free dental pop-up services being offered, make sure you stay tuned, and we'll be sending that survey around in late summer. And then we're also looking at, how people access dental providers, working with the United Way and the 211 system. So we want to make sure that if a community member is looking for a dental provider, we've had some concerns that you get this big list and you might call that list and maybe only 5 of them might meet your needs out of a list of 25. So we want to sort of be able to get people to get a more accurate list of the dental providers that can serve them. So we're sort of doing a scan of the state, looking at all the different options out there, and then hopefully we'll be able to put together a recommendation report in the coming months of how we can best move forward on that. As we wrap up here, just wanted to share some links for our resources. We've been maintaining a COVID-19 resource page since March, trying to make sure that if you're looking for the most up-to-date information, if you need the most recent CDC guidelines, if you want to know what the Department of Health has said last, that we keep all of them on that site. Everything is dated so that you know exactly when it was released, which I think is really, really important in a time where everything is changing daily. And then we've also got some additional resources like live webinars and recorded webinars on that page as well. So if there's information you need and you're looking specifically for COVID information, that's a great page to go to. Our general resource page is being refreshed right now, so it's still there, but it's going to start to look a little bit different in the coming weeks. So just a heads up on that. And then we just wanted to share a handful of our partners that work on the national level that have some pretty good resources that can be helpful. So DentaQuest Partnership, Community Catalyst, Campaign for Dental Health, and Open Network all have some really amazing resources. Anything you need to know public health and oral health wise, I think between those 4 you can probably find it out. And then last full slide here, just wanted to let everybody know about some of our work groups and our task forces. So if there's a place where you think, this work really interests me, I'd love to know more about these programs, or I'd love to help, we do have opportunities for that. We've got a great adult dental Medicaid group that meets once a month where we're trying to improve the access and the benefits that adults get under Medicaid and PA. We have our Family Oral Health Collective that looks at family oral health and how to best work with children and families. Obviously, community water fluoridation. We're always ready to have people join that team. And, we have some kind of as needed calls, quarterly meetings, just things to kind of keep everybody in the loop. So if community water fluoridation interests you, that's a good place to be. And same with our school sealing programs. If you're a certified school dental hygienist or you work for a federally qualified health center that goes into schools, our school sealing program work group might be a great fit for you. We do work with a number of local and regional oral health groups across the state. So if you're interested to say, hey, I'm in Perry County, is there somebody I can talk to locally that's doing work around oral health? We can also help connect you if there's a group available in that area. And lastly, just wanted to mention that, we have a formal board of directors, and in the next year or so, we're going to be looking to add some members, specifically with a legal or financial background. So I'm just putting that out there as just sort of, if you think of someone who might be a great fit or you're interested yourself, please feel free to reach out to us and we can give you some more information. Our Oral Health Summit that I know many of you were looking forward to. We hold them every other year, was originally scheduled for this fall in November, and we did make the decision to postpone that by 1 year. So I did put the dates for next year's Oral Health Summit on the slide there, November 11th and 12th. Please mark your calendars now, and we're looking forward to getting everybody together to really convene at that point. You know, it's been a tough year not being able to convene. And so, you know, we maintain a calendar on our website all the time. But I would like to do one last poll to sort of talk a little bit about and see how everybody's feeling in terms of getting together and information that you would like to hear from us. So Amy, if you can put up the poll. We typically hold our in-person meetings in the spring and the fall, and then we do these virtual updates in June and December. So, you know, just sort of wanted to know for the rest of this year, what really is what would kind of solve what you guys are looking for in terms of communication. So you can see the questions there, you know, if you want more informal meetings or if you like the more traditional style of this formal webinar, you know, or if you're happy, you've got Zoom exhaustion and you're tired of joining these meetings and you don't want to hear from us until December, you can select that option as well. So please make sure, you know, check out that poll. And I think, Amy, do you want to go ahead and put up the results of the poll there? Okay. I'm so glad only 16% of you said see you in December. We must not have aggravated you too much. So it looks like the bulk of the individuals said that, you know, formal webinar updates are great and interactive sharing sessions. So that's good. That sort of helps us to direct what we want to do. And I'll also say that, you know, if there's something that comes up or you see a need for more communication, even on a personal level, of course, you can always reach out to us and any of the staff members, because that's really, you know, what we're here for. So, and I know I saw some questions have come in through the chat box there, through the Q&A box, and I believe that they've all been answered by our amazing staff, except for, let's see here. Let me see. Dr. Greenberg asked a question around medical offices who treat large numbers of Medicaid patients could be screening for oral disease and providing educational coaching. Do we know if any are, especially in rural areas? I will say that that is a program that's actually been in play for quite a few years now in the pediatric realm. So we work with the Pennsylvania chapter of the American Academy of Pediatrics, and they do a lot of training around oral health to pediatricians. And they've reached hundreds of offices across the state. So I know that it's definitely happening in the pediatrician's office. They do anticipatory guidance. They talk about, you know, and they also make a nice referral to a dentist, which I think is really the vital thing. We've got to get these kids to a dental home. So it is happening on the pediatric side. I think that we could definitely make some changes on adult care side. You know, when we talk to an endocrinologist about making sure their diabetes patient is getting some oral health information. So those are things I think we definitely have to keep as good ideas. So thank you for that, Dr. Greenberg. Let me see here. And I think I'm just looking to see. Okay, I think we have. Okay, I just want to offer one more point of clarification on Dr. Greenberg's question about screeners. We are using public health dental hygiene practitioners since they are able to work without supervision in school settings. So I know Amy had responded it's dental hygienists, but I did want to clarify that will be public health dental hygiene practitioners. And we're really reaching out to the certified school dental hygienists because they would be really the prime candidates for doing that work. So. And any other questions coming in? Let me pull up the chat here. I see some. And okay. And let me just make sure. I know we had some questions about dental fluorosis, and I wanted to thank Marilyn Marsh, our fluoride guru, for answering that, because I know, Dr. Greenberg was concerned that maybe fluorosis is part of the pushback for fluoridation. And it really hasn't been a prime reason in any situation. So that's been pretty nice that we haven't had to really deal with that argument, but we don't see a lot of severe fluorosis in Pennsylvania. So that's a good thing. And then I think we had some questions on our surveys, which we've answered around the first survey still being active, and then that we are collecting information by zip code on that practice reopening survey. And let me see here. And I think we did have a comment too that UPMC for You is partnering with several dental offices to offer teledentistry virtual visits during this time. So I do know we're seeing so much more teledentistry, and I don't know about you guys, but I'm really hopeful that that means we're going to see it successful and that it should be used more. That's really where we're heading with it. So give everybody another minute here too to see if any more questions are coming in. I hope that everyone has learned a little bit today. Again, if there's a piece of the work that we're doing that you're really interested in and you want to learn more about, we are always available to offer more information. Please make sure you're following us. We do send out a weekly newsletter, but we also do a ton of posts on social media, and we put information up on our YouTube channel as well. So you can see, you can follow us at any of those social media sites. And then we also participate with Amazon Smile. So if you're not familiar with that, Amazon will donate 0.5% of all purchases made through Amazon to a registered charity of your choice. So we always encourage everybody. I know myself, especially during COVID, I think I've raised about $50 already for the coalition this year. So please make sure you check that out. If you need more information about how to set up Amazon Smile, we can help you with that as well. And so right now, I'm not seeing any other questions come in. So with that, I think we will wrap up for today. And again, thank you so much for taking time out of your day to join us. And we will hopefully see everybody, at least virtually, very soon. Thank you, everyone.